Thank you, Richard. Now to a health alert, changing the way ovarian cancer is diagnosed, specifically bringing attention to a test that evaluates a woman's risk. Joining me now is Olympic gold medalist and ovarian cancer survivor Shannon Miller, as well as Dr. William McGrath from North Florida OBGYN. Good morning to both of you. Thank you very much for being here, Shannon. Always good to see you. I know you've been a big proponent, considering your history, of spreading the word and getting the message out, because warning signs are so important, and they were for you.
Absolutely. Well, as an ovarian cancer survivor, it's important for me. And as an advocate for women's health, I want to get out and do as much as I can to help women understand not only what the signs and symptoms are for ovarian cancer, but the importance of paying attention to your body and talking to your physician. But now we have this incredible new test that's available for women, and I want them to know about it.
Doctor, if you could explain to us what this test is in particular and how it works.
The OVA1 is a blood test. It measures 5 different proteins in a woman's body. So once a woman has been diagnosed with an ovarian tumor, most of which are benign, not cancer, her clinician can order the OVA1. The OVA1 is a probability test. It's not diagnostic. It's not a screen. If it's more likely to be a benign mass, that mass can be followed and observed and perhaps repeat radiographic studies, ultrasound in about 6 weeks. However, if the test is positive, that means there's a high probability that that tumor is malignant, and that patient will not be observed. That patient is served by a GYN oncologist. A GYN oncologist is a specially trained gynecologist that just takes care of cancer patients. And so it allows that woman a comfort zone, whether to be observed, because most of these masses do go away, or off to
be
surgery.
More aggressive, right? And Shannon, this test was not around, obviously, then when you were diagnosed. How would it have helped you? I mean, even just mentally, right?
Absolutely.
As you're waiting for test results.
And that's a huge part. Anyone who has ever been or had a family member go through a cancer diagnosis, it's that waiting. It's that let's wait 4 to 6 weeks to see what's going to happen. And it's excruciating. It's that loss of control. And for me, I was extremely fortunate. I had an OBGYN who immediately contacted and consulted with a gynecologic oncologist. So I was very fortunate that I didn't kind of get bounced around, but we can't leave our health up to luck. Let's not do that. Let's make use of all of these tests available. And OVA1 is that tool in your toolbox, your health toolbox, that you absolutely have to utilize if you have a pelvic mass.
And let's talk a little bit about pelvic mass also, doctor, if I could, because what are the warning signs and symptoms of something like that? Because we're busy moms. You know, moms are really the last to say, hold on a minute, you know, maybe I need to go to the doctor and check out whatever symptom I'm having, because we're just so busy.
The symptoms are very vague. It's estimated that 60% of all women have no idea what the symptoms are. Wow. And that's why there's often a delay in diagnosis. Symptoms include indigestion, bloating, a fullness of your abdomen and pelvis. Your clothes are getting tighter, yet you're not gaining any weight. And bladder frequency, you're going to the bathroom quite often. So they're very, very vague, and a lot of the times they are confused with intestinal problems. Yeah. And the patients end up at the gastroenterologist and intestine doctor before they ever see a gynecologist.
So this is a question then that you shouldn't necessarily be having with symptoms with your primary care, but with your OBGYN.
Correct.
Thank you both for being here. I appreciate it. And Shannon, I know that it's so important, obviously, for people to know the warning signs and know more about this test. Shannon's going to be holding a Twitter chat coming up at 9 o'clock, so in about 35 minutes this morning. She's going to talk about pelvic mass, her journey also to being diagnosed with ovarian cancer. You can use the hashtag #NoPelvicMass.